With Angelina Jolie's recent double mastectomy filling news headlines, we feel driven to look at our own cancer risk. Join us today is Dr. Lisa Madlinsky, an expert on cancer risk and genetic testing. She's here to shed some light on how you can ensure your life isn't cut short by cancer, or at least try and help with that. Welcome to Primetime.
Thank you for having me.
Okay, so we were talking the break, and we'll go ahead and share with the viewers. I was wondering with all this Angelina Jolie stuff, where she found out she had the genetic link,
Right.
She decided to have a double mastectomy. There was a story we did yesterday. The aunt died here in San Diego, and the aunt's husband said, you know, we found out that she had the genetic link after she was diagnosed. We wish we would have found out before.
Right.
With that being said, I'm a mother of 4 daughters. I thought, well, maybe I should get tested.
Right.
Now, you have the expertise to tell us. So you asked how many families. So go ahead and ask me the questions so the viewers.
So what we start off with is basically an assessment of the family history. So we want to know things about your family history, like which relatives had cancer.
My aunt and my first cousin, breast cancer.
We want to know where the cancer started. So you said it was breast cancer.
Yes.
And the reason that's important is a lot of
there's also
times
brain cancer, lung cancer, and other people.
Right.
Okay.
So the reason we want to know where it started is sometimes people will remember their relative having cancer after it's spread. So they may think, oh, you know, my grandmother had lung cancer or brain cancer or bone cancer, but maybe it actually started in the breast or somewhere else. So we want to know where it started.
Okay.
We want to know how old people were when they were diagnosed. In general, the younger you are when you have a cancer diagnosis, the more likely it is to have a genetic component.
I didn't know that.
Yeah.
And when you say young, what is that?
So for breast cancer, any woman who's diagnosed with breast cancer under 50 is someone who should actually consider doing these genetic tests for the BRCA genes. Women who are diagnosed in their 60s or 70s, it's much less likely that it will be genetic, and so testing may not be as important for them or for their family members.
That's good information.
Yeah.
That's good information. So what's the harm of me just getting tested? Because I have to stay alive to raise these daughters, and there is cancer prevalent in my family.
Right. So, and ever since the Angelina story came out, these are exactly the questions we're getting from women in the community.
Right?
Absolutely. Yeah. So a lot of young, healthy women come in and they've been calling and emailing and saying, can I get the test? And it's not just a simple blood test. There's actually a lot of complexities with it, and it's not just a test that your doctor orders, comes back, and you get your result.
Bummer.
I know. If only it were that easy.
I just want to know. But from what I understand, the BRCA one too, it can manifest in other areas, other types of cancers, not just breast.
It's predominantly breast cancer and ovarian cancer. So the ovarian piece doesn't seem to get talked about as much as the breast cancer risk.
And that's a real deadly cancer.
It can be. It can be. So that's why we want to try to use the genetic information to do something about it. So, you know, your question about why can't I just go in, get the test, and have my answer. Ideally, we want the first person in a family who gets tested to be someone who's had a cancer diagnosis. Because we don't know, did they get breast cancer or ovarian cancer because of the gene, or did they just randomly get those cancers and it had nothing to do with one of these genes?
What are the chances of randomly getting those cancers?
So most breast cancer is not caused by the BRCA genes.
I did not know that.
Most ovarian cancer, not caused by the BRCA genes. So
just
maybe 5%.
Freak mutations or environmental issues?
A combination. So family history is a part of it, even if you don't have the BRCA genes. There's also, you know, lifestyle. We know taking care of yourself is really important. Diet, exercise, not smoking, drinking in moderation, all those things play a role in cancer risk. Reproductive factors like hormone exposures. We know women who take hormone replacement therapy for a long time after menopause, their breast cancer risk goes up. So there's a lot of kind of moving parts that make it complicated. The BRCA genes really are only responsible for a very small percentage of breast cancers and ovarian cancers.
This is really important news for people to hear. They're going to feel relieved.
I hope so. I hope so. But for people who do have a pattern in their family of young breast cancer and ovarian cancer, in those families, it's important that whenever possible, the first person who gets tested is somebody who's had that cancer diagnosis. So we can say, was their cancer caused by the BRCA gene or not?
But why? I'm all about nipping the problem in the bud before it becomes a problem. Why shouldn't we just have one family member get tested before they have cancer?
So ideally, you know, we may get there in the future.
But it's not cost effective.
It's not cost effective.
And insurance isn't going to pay for it.
Insurance may pay for it. They may pay for it in some situations.
And how much is it if insurance doesn't pay for it?
So it depends on a few little things. So how strong is your family history? What is your ancestry? We know people who have Jewish ancestry have higher rates of having these genes present. So we actually do a different test if you have Jewish ancestry.
Okay. What else?
So if you have Middle Eastern ancestry or Hispanic ancestry, there's kind of a second level of BRCA genetic testing that's offered. And so there's, you know, all these nuances and complexities. So we really recommend people sit down with a genetic counselor or a cancer genetics expert to review the family history and learn about what type of testing.
By the way?
Sweets, I have no problem with that. I have no problem with that.
Well, we know they do get cancer. We just,
Yeah, no, I have no problem with that. But the reason it's so important to have that first person in the family who's tested be the right person is if they test positive and we find out, you know, yes, this is a family that carries this BRCA gene, then we can actually branch out and test any other family member and we get an accurate result. We know who in the family inherited the gene and has the high risk.
So it makes your job easier as well, more accurate.
It's more accurate for the patient. If you were to go out and get tested and it came back negative, we're kind of right back where we started because we don't know were the cancers in your family because of the BRCA gene, in which case you tested negative and you don't have it, so that's great. Or is it that the cancers in your family happened and it had nothing to do with the BRCA gene, and so this test doesn't tell you anything?
And I heard that you could have the BRCA gene, be a carrier, and not necessarily get cancer.
Absolutely,
so
absolutely.
it might be like a rush of mastectomy surgeries when it's not necessary as
well. We as far as what to do for women who do carry the gene and who do test positive, there's a lot of options. You know, Angelina Jolie chose to go the mastectomy and reconstruction route. That is a very reasonable choice for women with a positive genetic test. Not all women choose to do that. Some women will opt to go for regular mammograms but add breast MRI onto their regular mammograms. Is that
more accurate?
It's not necessarily more accurate, but it's...
Can I hold you to the next... We're going to take a quick break and bring you, because I want to talk about the best way to get... Because mammograms sometimes aren't accurate for a lot of people depending on breast tissue and whatnot. So I think this is really important for women to hear this, and it could save someone's life. So stick around. We'll be right back. We're back with Lisa Madlinsky. She's an expert in testing for BRCA. 1, 2, and all different types of cancers. So before we took a break, we were talking about the different types of mammograms and testing for breast cancers.
Right.
What is the most effective and fit? Not the one that insurance is going to cover, the best out there.
Right. So there's different ways of looking at breast tissue, and a lot of it depends on what is your risk, what is your age, what is your breast density. So a lot of factors go into making that decision.
Right.
The test that has the most evidence to back it up is mammogram. It's not perfect. There's really very few perfect tests in medicine.
Well, it's not good if you have a lot of dense
breast tissue,
or implants or whatever. It's not as good.
It's actually okay. It's again, it's not perfect, but it should pick up the majority of breast cancers out there.
For those where it's not an option, it hasn't been a good alternative, what do you suggest?
So for women who have a high risk of breast cancer, and what the American Cancer Society recommends is any woman who has a risk of breast cancer of greater than 20% over her lifetime. So to put that in context, the average woman walking down the street has a risk of about 12 to 13%.
Okay.
So if you get up to a level where your breast cancer risk is 20% or higher, that includes women with a BRCA gene mutation. For those women, MRI of the breast is a very reasonable choice. The trade-off with breast MRI is you can have false positives because it is very sensitive at seeing any little thing in the breast. So that's the trade-off. It's not a test we recommend for everybody, because then the majority of women would be going in and getting biopsies and being distressed and having to go through a lot of anxiety.
I'd rather go through unnecessary anxiety than have cancer.
Well,
Okay.
the other thing is it's not going to prevent cancer.
Right.
The whole goal of screening is early detection,
yeah.
catch it when it's treatable. That's the goal.
And we'd like to have you on either later in the week or next week to talk about if there's anything we do to prevent it, because I know we're talking about lifestyle and whatnot, and the next step in breast cancer, it is a hot topic right now, and I think women across the country are more aware, and they want to be alive for their families, to have a fulfilling life, and we need to have less breast cancer cases.
Absolutely.
Thank you so much for coming on.
My pleasure. My pleasure.
Thank you.